Hey, Dr. Lamoreux.
Good afternoon.
Welcome, welcome. I'm excited to talk to you about this. We're talking about the link between, mental health and hormones. Obviously, a huge area, but one that we talk about with patients constantly. You have a really very unique background, in addition to being a naturopath. Talk to me about that.
Yeah, so I'm a naturopathic doctor and then also a licensed counselor. And so I have background in training as a therapist, which
Great.
has come in so handy when
Yeah.
treating things like depression or mood disorders,
Yeah.
because I have a pulse on like what's happening on the psychological side of things and what's happening on the physical medical side of things.
That's awesome. Yeah, it's such a unique combination. So talk to me when a patient comes in to see you. Obviously, people, come in to see us with things like depression, anxiety, and on from there. And when you suspect there's a hormonal component to it in men or women, obviously, well, like, what is your approach? Like, where do you go?
Yeah, first and foremost, gotta do some testing.
Yeah.
Um, I like obviously there's lots of quizzes and things that can, suggest
Mm,
having like a deficiency or excess in a hormone, but we got to get some data.
yeah.
We got to do some blood tests. So there's kind of three ways that we'll go to get data, like blood, saliva, urine. Kind of
Hmm.
depends on the specific context which we want to use for our test.
Right.
We need to know what those levels are,
Yeah.
because sometimes people are expecting their levels to be super high and they're actually low, or vice
Right.
versa, or like or it's not the hormone that
We
they
can't
thought it was.
always, right. We can't always predict, right? Just based on presentation. So,
Exactly. So for example, like a patient may come in and say like, oh, I think there's like a problem with my estrogen levels. And then their estrogen is actually fine, but we test their thyroid and their thyroid is completely out of
yeah,
balance.
that's a good
So
example. Yeah. Right. Yeah. So getting a clear picture on how patients look. So yeah, everyone's unique, right? That's what I always say. For 10 different patients, with the same set of symptoms, we'll have 10 different, sets of findings. But what are some through lines? Like why do we investigate this? I mean, which this differentiates us from, a psychiatrist, right? If people go to a psychiatrist, obviously they're probably going to get medication. What are we looking for? Why do we investigate hormones? Like, what are the through lines that we see?
so from the naturopathic philosophy, we're trying to
Mhm.
treat the cause.
Right.
We're not just trying to throw things at a person hoping that it improves their mood.
Right.
And so, like, we can take a look at like, okay, like how are your hormones impacting your mood? And then, of course, kind of taking that step further in many
Right.
cases of like, okay, so what's
Yeah.
causing the hormone imbalance?
Yes.
Um, but it's a lot easier to do that and kind of find the cause once we actually know what's going on with your hormones.
Yes.
There's so many people who really haven't truly had their hormones tested. Maybe
Your
they had
point. Yeah.
one single blood test at some point, but
Hmm.
we like to be very thorough because that helps us to make things more targeted, kind of address the cause,
Right.
um, and then improve symptoms that people are
Right.
experiencing the hormonal imbalances.
Right. And we're talking about when we talk about hormones, as you said, thyroid, we're also talking about adrenals, right, which play in with men and women, and then the sex hormones, right? So there's a lot of ways to, when we talk about hormones, like, a lot of ways to skin that cat.
Exactly, exactly. And I know a lot of people come to me and they're more specifically interested in sex hormones like estrogen, progesterone, testosterone.
Right.
So a lot of times I'm like, hey, we got to include your thyroid and what's happening
Yeah.
between your brain and your adrenals with your cortisol levels because
Yeah.
that, especially for mood. And so th those all are kind of affecting each other anyway.
Right.
And there's a lot of connections between the thyroid, our adrenals
Yes.
and cortisol, and our sex hormones,
Yeah.
and so we got to kind of untangle like why is this, uh,
Yeah.
why is it out of balance, and how can we fix it?
Right. And how do we address it at its root, as you said? Super exciting. It's fun to talk to you about this stuff. So thank you so much.
Yeah, of course.